Dr. Kelly.
Good morning.
How are you today?
Great. How about you?
Doing so well. It's Friday. The weather is beautiful. No complaints here.
Right? Yeah. It's nice to have warm weather.
That's right. That's right. Well, welcome to Breakroom Mom, Dr. Kelly. And for those who do not know you, you are a practicing clinical psychologist in the state of North Carolina, and you have been practicing for the past 15 years. I know your area of specialty is assessments for autism, therapy for autistic individuals and their family members. And you hold a doctoral degree in psychology and 3 master's degrees, my friend.
Yeah. Overachieving middle child.
I love that. I love that. And it sounds like you've been a special education teacher and a board certified music therapist. I mean, the credentials do not stop. Well, my friend, we have a lot of ground to cover today. Lots of questions about neurodiversity, about autism, all the things. So let's jump into it. How about it?
Sounds good.
Okay. So talk to me a little bit about your clinic and your practice. You know, what are the typical patients that you're seeing?
So for assessments, I usually see patients anywhere from about 2.5, 3 years old, on up to young adulthood. And then for therapy, I also fall in similar age ranges as well, from little guys all the way on up to young adults.
Let me ask you, because I think that this is an important one for my listeners. My listeners tend to be, millennial moms who are in the throes of raising young children and balancing all the things. And I have to say that I think as moms, we sort of have this gut feeling long before, a diagnosis. And so from your perspective, I'm sure you deal with this a lot, is how should a mom navigate something feels off to pursuing a formal clinic evaluation?
So I often hear that a lot from parents, that they've had a feeling for a long time. And first off, I love to acknowledge that, because I think a lot of professionals just dismiss it. But your child best. No matter how much the professional thinks that they know your child, they aren't going to know them as well as the parent is. So I think that we do have to take a lot of that into consideration. So if the mom feels that something isn't right, you push and push until you get what it is that you're looking for, which is usually an evaluation. So, and you can press that with your pediatrician for sure. And if your pediatrician still isn't listening, you can always pursue it on your own by contacting clinics that do autism evaluations.
Awesome. And it sounds like you're a huge advocate of if you feel like something is off, keep pushing because you're the mom.
Definitely.
Yeah. All right. So let's head into maybe that we reached that point of diagnosis with a child, to a mom who is relatively new to this topic or just managing a lot within their household. There's some surprising terms, right? Like executive dysfunction, sensory processing, a lot of just jargon. And so can you break down maybe 2 or 3 that are most common terms that you use that you feel okay, every parent should kind of understand these?
Yeah. So probably the biggest one that I use all the time is, RRB, restrictive and repetitive patterns of behavior.
Okay.
And I always have to catch myself because I do often just call it RRBs. And so with restrictive repetitive patterns of behaviors, that would include anything sensory, so sensory avoidance, sensory seeking, any kind of hand, finger, or body complex movements, self-injurious behaviors. And then the other term that goes under this as well is the stereotypical behaviors. And stereotypical behaviors are basically include a bunch of frequent, repetitious, or purposeless, well, often seen as purposeless, rhythmic, repetitive behaviors. So these could include stimming or self-stimulatory behaviors. That can be movements. It could be sounds. Like a lot of times we'll get kids who just make like odd sounds on a regular basis, and that's more of a self-stimulatory kind of thing. Cognitive rigidity or getting stuck on things, not being able to move past a specific thought or idea. So to me, those are probably the biggest terms that I frequently use and are probably more difficult, I think, for most parents to understand because it's so complex.
Yeah. Thanks for breaking that down. That makes good sense. I think something that is really, really positive in my mind is we're seeing this massive shift in how neurodiversity is understood and accepted compared to when I was a kid, right? Like it just wasn't even talked about. Mental health, none of that, right?
Yeah.
So how do you explain the neuro-affirming approach, which I think is where we're headed, which is wonderful, to a parent who may just be starting out on this journey and it's all new to them?
So the way that I explain it to parents as well as to patients is that neuro-affirming is really the understanding and acceptance that all brains are different. And so I think a lot of times neurodiversity, that term is really used for autism or ADHD, but I really think that there's all different kinds of brains that are different as well, right? So even people with persistent depressive disorder or anxious brains, those are very different. OCD brains. So I feel like it really encompasses any of the mental health conditions by just recognizing that those particular brains tend to function and work just differently.
Yeah. And I love it. Like, I love that you're not just restricted to ADHD or autism, but it really it spans everything. Like everybody just functions a little bit differently.
Yep.
That's awesome. Okay. Well, I think that we couldn't talk about neurodiversity without bringing up this huge sort of massive trend in social media where we're seeing neurodiversity a lot in social media. I don't think I can scroll on my phone without seeing the things like you may have ADHD as a woman in her late 30s, early 40s, if you're not exhibiting these 4 things, or it's just everywhere. So how do you help people distinguish between what is helpful information versus misinformation, or even just these like self-diagnosis trends that seem to be buzzing all around?
I think that a lot of times, even with the self-diagnosing trends, there can still be a lot of good that comes out of it. Like I've had older individuals, and by older, I mean like more teenage individuals who've said, oh, I saw this on TikTok and, I thought it related to me. And sometimes they're absolutely right. It relates to them, where I'm like, man, you're like 18 years old and you didn't know you had autism. Like, that's unbelievable. So I think sometimes it definitely serves a good function, but I think that we need to take it with a grain of salt. Like, it can be something that could be a little bit more. And then at that point, it's good to pursue that with your doctor, psychiatrist, or therapist, or seek out an evaluation. If you are noticing that you have a lot of characteristics. But one of the things that's really been frustrating me lately is I've been seeing basically autism evals that are not autism evals. So they're being called neurodiverse assessments. And first off, neurodiversity is not a diagnosis. Like I said, it's just to recognize the way that brains work differently. Different brains work differently. So a neurodiverse assessment isn't necessarily going to evaluate you for autism or ADHD. It's just seeing if your brain is functioning differently. So it's not an official psychological evaluation. So I worry that some people would see that and they would be like, oh, great, I can go get, assessed and end up with a diagnosis. And because neurodiversity isn't a diagnosis, you're not really ending up with a diagnosis. And then on top of it, not all neurodiverse assessments are even conducted by psychologists. So some providers like counselors, or even licensed clinical social workers that do not have the same assessment training and psychological evaluation training that a psychologist has, are doing these assessments. So it's kind of questionable then to the source that it's coming from. So I do think that that's a concern for the general public. So whereas something that can start as like a good idea to get information out can lead people maybe not into the direction that they're really looking to go into, which would be to get a formal diagnosis.
Yeah. So a couple things that I heard is it can have some positive impact, right? Like people can see things and it can push them into getting an assessment, and that's all great and wonderful, but be wary of the source and make sure that it's actually the right thing. It's not just some sort of larger neurodiversity assessment. So if you're a mom and you're listening and you're seeing that, I get targeted with these all the time, the signs of ADHD where it's like you walk into a room and you forget why you walked into that room or something like that. Like, don't just self-diagnose necessarily, but maybe use it as a tool to talk to a professional.
Absolutely. Absolutely. Yeah.
So let's talk about parents of children who may have autism or ADHD, and they're looking around their homes and thinking about how can they make it more sensory friendly or accommodating to this person, and not be really overwhelmed that this is just like a full project where it's like every room has to be, the playroom now needs to be sensory friendly, the kitchen now needs to be sensory friendly. Like that can feel very overwhelming to a lot of people. But as parents, we want to do the best things that we can for our kids. So talk to me a little bit about like where the line is of compromise and what advice you give.
So often I give just setting up a specific space for your child. And it doesn't even have to be a whole room. It could be, like a large box in a room, or it could be a closet space in a room. So it doesn't have to be this big room with all this stuff going on. And I say to, design it according to what your child's sensory needs are. So do they do a lot better with less sensory input? So do they need a pretty stark environment without a lot of noises, maybe some cuddly spaces, some weighted blankets, just having their stuffies all around them? So whatever is really going to work best for your child's individual needs. And like I said, it doesn't have to be like a big space. For years when I first started working, I had a desk that like the kids were able to go underneath. And I found like a lot of my younger patients love to just go underneath my desk and just kind of like use it as their like sensory comfortable space. And I really loved that. And parents were like, well, I could set up a room. And I'm like, no, they kind of like a small space. So don't set up a room, like set up a small space for them and let them really design what it's going to be and, what they need in there for their own creature comforts.
Do you give advice? Like, I assume there's probably like two sides to this. Like one is, to your point, the smaller space, it's cuddly devices, it's things for calming, but then we also have like our sensory seeking population of children. And I imagine for them, it's, I don't know, what do you give advice? Like ability to play music, movement, like where do we go on when it's that end of the spectrum?
I still think that you can go with small space. because I still think that there's a lot of things that you can use to get sensory input. So even if it's a small space and the kid is just kind of like pushing their legs and their arms up within a small space, right? So they're getting that kind of pressure. And so that really helps for a sensory seeker. Or weighted blankets can be really helpful for a sensory seeker. Or headphones with loud noises coming in, or lots of noises kind of coming in all together. So having TV on as well as like music playing at the same time. So it can still be this small space. It doesn't have to be this big room where, I've had some parents that have put like climbing walls up and swings, and like, that's all awesome and amazing. But I don't think that every parent has to aspire towards doing that, even if their child is a sensory seeker, right? They're just looking for sensory input from different things. So that could be even just having like a spiky ball that they hold and kind of rub on themselves. So it doesn't have to be as big and as commercial as the world has made it seem like it needs to be.
Yeah. And I like that advice, because those climbing walls and swings from the ceiling, like, that's also not accessible to every patient or every parent from a financial perspective either.
Absolutely.
So finding those shortcuts, like you said, is super helpful. Man, this one really resonates with me, which is top tips for a parent struggling with executive dysfunction while trying to manage their child's schedule. And maybe for the listeners, we should define what executive dysfunction is, first of all.
So executive dysfunction is really difficulty managing thoughts, feelings, actions that often affect planning, organization, flexibility, working memory, and impulse control. So it's kind of a bunch of different things that are working together. The way that I often describe this to parents as when you ask your child to clean their room and you come back 30 minutes later and they're sitting on the bed and haven't done a thing, chances are that's a kid with executive dysfunction, because they don't even know what they're supposed to do first. They just see it as this really overwhelming task that they can't break down. So I agree with you. I think that executive dysfunction issues can really affect getting out the door in a timely manner. So the first thing is that establishing routines as best you can, and letting those routines, sometimes they can be visual. So if you have like a visual list of what the child needs to do, even setting timers for them so that they have that external reminder of the time that's going by. And make sure that you teach the routine first. Don't just assume that because you made a pictured list of what they need to do, that they know what they need to do and how to do it and how long it takes. Like, teach it, but don't teach it on a Monday when you're trying to get out the door. Teach it on like a Saturday or Sunday morning when you don't have to get out the door in a timely manner. And then also letting some things go, like if you can't get the shoes on them, then that's not really going to be the end of the world. Then you stick the shoes in the car and you deal with it once you get at your destination. I think that like the most important things to train are the things that your child needs to be able to reach an independent state. And so flexibility also has to be a need that they learn to deal with at their independent stage. And so that flexibility could be, I'm like going so crazy today that I just can't handle getting all of these things done. So what's the most important pieces that I need to get done? Is it something where like they can just eat something in the car instead of eating breakfast at home? Or can they just have breakfast once they get to school?
Mm-hmm.
So just try to find ways where you can make it easier for yourself as a parent so that you can get to the final destination, and allow yourself some grace with that.
Do you recommend to parents who are making those, I'm going to call them prioritization choices, like the shoes are going to go with us in the car, or you're going to eat breakfast at school? Do you recommend that the parent like say that out loud to the child? Like it's a, we're limited on time this morning. We're going to need to call priorities or something like that. Or does that just make it more overwhelming for the child? Because I think there's a benefit to just like modeling some of the behavior. Like, I need to make some key decisions about what's important. Or does that inflict a little bit of guilt or shame on the child for not meeting certain deadlines?
I think it really depends on the kid.
Really?
Yeah. Some kids get like super anxious when the routine isn't followed. And so if they know that, oh, you got to eat in the car today, that might really throw them off. That might really throw an anxious kid off and make them feel incredibly overwhelmed. So I think it really just depends on your kids. Some kids do really, really well with kind of those prompts and guidance with, hey, we're really limited with time today, so we're going to need to blah, blah, blah. And they can kind of roll with that. And then they also get to see your problem solving skills, which I think is always good for kids to see their parents and how they problem solve. Because that's going to teach them how to problem solve as well. So for some kids, like that can work really, really well for them. But for other kids, it can just make the situation even more overwhelming. So again, it really depends on the individual needs of your child.
Yeah. All brains are different.
Yep. Yep.
I want to talk about a biggie here, which is, a diagnosis. While I imagine there is a certain element of a relief for the parent, maybe even for the child, to be able to label it, to be able to name it. But I think it can also bring a heavy set of emotions with it. Perhaps, the parent struggles with the impact to this child's childhood, their life, like how they're going to maneuver the world. And so how do you help parents sort of process this loss of a neurotypical life that they envisioned for their child?
Yeah. It's interesting because I think that people think that happens more often than it actually does. And I think that could be the approach that I use and the approach that like colleagues I've worked with have used. So I think it's acknowledging those feelings in the first place. So if I have a parent who, really starts crying or getting, visually upset, I acknowledge that, wow, this seems like, this is really hard for you. So, what's going on for you? What's going on through your head, so that I can make sure that I can really address whatever is specifically causing issue for them in that moment. But the other thing that I like to explain is that I like to go into strengths and differences with autism as well, so that they don't just see it as deficit, and pathologizing, their child. I think it's important for them to understand, like, what are some of the strengths that can be associated with autism? And what are some of the things that your child probably will struggle with more because of it? And how can we make sure to address those things so that they aren't completely overwhelming for your child as well as for yourself as the parent? So I really like to try to bring up as much of that as possible, especially when discussing the diagnosis in the first place, just to help get it all out there. And the other thing is that with like the really little kids that we diagnose, like 3-year-olds, 4-year-olds, 5-year-olds, I explain that our assessment is a snapshot in time. This is just what I'm seeing within this brief moment. Do I know what the overall prognosis will be? No, I don't. But I can tell you what the things are that if you start these things today, that they will improve your child's prognosis. Then, potentially that can change the whole trajectory for a child, as well as for the parent. So I think like that's the other piece, is not getting so caught up when you get a diagnosis at 3 or 4 that, this is the pathway that my child will follow. Because we don't know.
We don't know. And the goal is, I imagine, to help many kids with autism overcome, or maybe overcome is not the right word, but learn and how to navigate some of the challenges or perceived challenges that they may go through. I assume that's like the ultimate goal.
Yeah, definitely. And I find that that tends to be a big part of my therapy, especially with the older kids. Which at first, when parents hear that, they're like, oh, well, so you're going to teach my child what excuses they can make because of their autism. And I'm like, no, like, I'm going to teach them how not to make those excuses, but rather I'm going to teach them that, these can be difficulties that you may struggle with. And so if you happen to see this behavior happen, that's when you need to kind of stop and give it some insight so that you can figure out, hey, what's the better way to handle this particular situation?
That makes sense.
Yeah.
I think this leads really naturally into my next question for you, which is, how do we coach our kids through social situations where other parents or peers may not get or know about their neurodivergence?
I'm a big believer in educating others. So, every parent is different. Some parents are going to be more confrontational, and other parents are just going to, not say anything. But I think that it's a good thing for us to educate others and educate other children. So I know, like, when I worked in the school system and when I worked with kids on the autism spectrum in the school system, I often recommended that it's not such a bad idea to have a discussion with the rest of the class to explain what autism is and what some of the behaviors are that they might see from this particular child in the classroom, and how, they're there as part of the treatment team as well. So this is how they could potentially help this child in these settings. I had a parent a long time ago who did an introduction, kind of a one-page introduction about their child that they would bring to every new teacher. And I know, I loved it. And they would bring it to the IEP meeting and they would read it aloud in the IEP meeting at the start. And it's like, I just thought it was so cool because it personalized their child. It made them their child, not a diagnosis. Right. And so I think like hearing that come from a parent is so powerful, because every parent just wants their child to be accepted and liked and have a positive experience in this world. And so if something as small as that can really help that process, which I think it does, then more power to it,
Yeah. That's such a cool tip. You used an acronym, and I just want to make sure we explain what that acronym is to the listeners. You used the acronym IEP. Can you explain what that is?
Yeah, so that's the Individualized Education Plan. What I found with particularly North Carolina education systems is that they'll only consider an IEP for autism if they feel that autism is impacting the child's academic progress. So if they don't feel that it's going to impact the child's academic progress, then they won't usually go forward with an IEP. I disagree with that because I think that in a lot of ways, autism, even children that are less impacted by autism, are going to have issues that come up and impact their academic progress. I think that a lot of times the IEP for autism is really used more for kids that need more specific academic supports or even self-contained kind of classroom settings or pull-out services, and less so for kids that may need academic supports within that classroom setting.
Yeah, that makes sense.
Yeah. So like a good example I can give you is that I find often even kids that are less significantly impacted by autism, who are in regular education settings, once we start to get into educational programming that is more about applying the information, that's where they tend to struggle a little bit more. So I had a kid who was really struggling with ELA, or English Language Arts. And the one assignment that really sticks in my head is that they were asked to compare and contrast internment camps to concentration camps. So this kid wrote an essay about internment camps and wrote an essay about concentration camps. And that was it. Like, they didn't get how to, compare and contrast. Yeah. Like, they just couldn't figure that piece out. So in their brain, they had done the assignment.
Sure.
They explained what was going on with concentration camps and what was going on with internment camps, but they didn't quite know how to blend the two together and argue the points from different angles. And, that goes with that perspective taking, right? And perspective taking is really lost on individuals who fall on the autism spectrum. So it's like, if you can't perspective take in social situations, what makes you think you can perspective take when writing an essay?
Yeah, in an academic setting. Yeah. That's really interesting. Hey, and one way to do the assignment.
Right. And again, like, if someone was, acknowledging the neurodiversity, they may understand that, oh, this kid, felt like they achieved the goal of the assignment. And so maybe it requires a little bit more hands-on or education on how to do that comparison at that point. Because to them, they think that they did it, but the teacher thinks that they didn't quite complete it. So I see it more as an educational opportunity than a just, I'm going to give you a bad grade because you didn't do what I asked you to do.
Yeah, totally. I'm right there with you. Can you break down the biological difference between a sensory meltdown and a boundary testing tantrum, and how a parent should respond to each? And I think that this is really hard for parents, right? Like, are they just doing, and to your point, like lots of the little ones, the toddlers and stuff like that, like, are they just doing what they do as toddlers, or is this something different?
Yeah, it's really a great question, because I think that a lot of times, not just lay people, but also professionals kind of interchangeably use the terms tantrum and meltdown. And they're really two separate things. And I know sometimes I make that mistake too, because I'm trying to use the vocabulary that my parent has when they come in, right? So, but basically a meltdown is just this intense, involuntary response to like overwhelming sensory information or an emotional situation, really resulting in a temporary loss of behavioral control. So it's really this out of control, and no matter what kind of tools and explanations you use, you can't seem to like rein it back in. And so I had a kid recently who did this in my office, and they were like 10 years old, and they were literally like rolling around on the floor, and just could not get themselves back together. And so like my response to that is, hey, let me know when you're ready to get back to what it is that we're doing. I'll just wait here until you're ready. If you need any help, let me know. And then I might, chime in again, like another 5 minutes later. If you need some help, I'm here to help you. Just let me know when you're ready. Because a lot of times with that meltdown, you need to just let it run its course. Like there isn't much that you're going to be able to do to stop it or change it. Like once it's already started, it's there, it's going on, it's not going to change, it's not going to stop. And meltdowns usually last for over 5 minutes. So these are not like the brief things that you often see with temper tantrums, where the kid kind of has this explosive event, and then they're able to kind of get themselves back together. And it's more of involuntary control. Yeah, they've just like lost all kinds of ability. They've lost all their sensibility in being able to handle the situation.
When a child is experiencing that meltdown moment and you're saying like, hey, I'm here, or let me know when you're ready, is part of that because if you were, I'm just going to say constantly saying like, okay, are you ready? Come back. Like it's not even going to go in at that point because it's lost. Like they're not even going to take it in.
Absolutely. Yep. It's a waste of time, energy, everything else.
Yeah.
So it's much better to just kind of let it go its course. And if they need help, they can, ask for assistance. Sometimes like I'll have kids who say that, they just want their mom to like hold them and give them a big bear hug. Right.
Mm-hmm.
So sometimes kind of they need that sensory input. And, that's fine. Like that's asking for help and that's acknowledging what's going to help them in that given situation. So, that's totally fine to do. But yeah, you're better off just kind of like letting it do its thing and just getting through it, which I find is really, really hard for parents. Whether it happens in public or in private, it tends to be really, really hard because in both of those situations, it means that a parent has to realize that there is nothing that they can do to help their kid. So they are helpless. And first off, nobody likes the feeling of helplessness, but especially a parent knowing that there's nothing you can do to help your child in that moment, like that's just a double whammy hit, right? Because it's like, it's one thing if I feel helplessness about myself, but knowing that about my child that, I put first, like, whoa, that's even more extreme.
Yeah. I think, go ahead.
No, you go ahead.
I was going to say, I totally get it. And also I think it's very hard for parents to see their child suffering. And so whether that child is truly suffering or not, like, I think it's just very hard for a parent to watch and witness. And to your point, not being able to do anything to stop it.
Yep. It's, and then, like if you're in a public arena, what makes it worse is that you have all these eyes watching you and sometimes commenting, right? And telling you, what to do, which is really not helpful at all. And if anything, like people should be patting the parent on the back that they're, handling the situation in the first place.
Yeah.
They can't just like, sometimes you're just not in a place where you can pack the kid up and get them in the car, especially if they're a bigger kid. You can't just pick them up and drag them off and put them in the car and let them have their meltdown in the car. Sometimes it just needs to happen where you're at. And yeah, I just think that puts extra stress then on the situation.
Yeah. So total meltdown, loss of sensibility, just need to let it run its course. I think to your point, tantrums are a little shorter. They can feel equally as hard, I'm sure, in the moment, but definitely shorter. And it feels like depending on the child and depending on the tantrum, you can get to them. You can channel them and you can kind of talk them through whatever they're experiencing.
Yeah, definitely. And, it might even be like with the tantrum, Yeah, there's some things that are hard and fast rules that you're asking the kid to do, and you have to follow that. But sometimes there might be some things that can have more negotiation to them. And so during a temper tantrum, like, you can do more of that negotiation within it. Whereas with the meltdown, you're not going to get very far with negotiation.
Yeah, that makes perfect sense. So I think that this is another tough one for parents. There is such a focus on gentle, neuro-affirming discipline. You know, when Kathy was on the podcast, we talked a lot about like the different schools of parenting, conscious parenting, gentle parenting, and especially for parents of neurodiverse kids. I mean, this is almost even more important or more highlighted. How do we make sure that as parents that we continue to provide that neuro-affirming discipline when maybe there are times ourselves that we are triggered and overstimulated and it's been just an incredibly hard day all the way around?
First off, I always think that it's okay for the parent to like share their emotional state as well. I think that as parents, we often tend to hide our emotions because we think that we have to present a certain way to our child. But the thing to remember is that our kids learn how to handle different emotions based on what they see us do. So if we're always hiding because we're crying and we don't want our child to see us sad and crying, well, then the kid isn't going to, understand that that's okay and that's totally acceptable to cry in front of another person, right? Like that you have to hide. So I think it's the same way with any of those emotions. So, if you as the parent are just feeling incredibly overwhelmed and you just need a break, then you need to say that. Like, you know what? I'm really overwhelmed here. I've had a really difficult day too. I just need to take a break. So, how about we both just take like a 10-minute break and then we'll come back to whatever it is that you need to come back to. So parents should not be afraid to acknowledge their own feelings with their kids because, again, it's going to teach them how to handle those feelings as well. And I think the other piece too is that the most important behaviors are the ones that your child is going to need to be successful in the world. And, safety for those is always your number one. So anything that's a safety-based behavior, to me, those are the ones that you have to follow hard and fast. Like there is no negotiation. There is no discussion about it. You just cannot run into the street. That's it. End of story, right? But then other things where it's not a safety concern, can be much more of a teaching kind of moment and more of a flexibility kind of opportunity. So, like I gave the example of like putting the shoes on earlier. Yeah, the kid needs to know how to put their shoes on, but if they're just refusing to do it every now and then, that's probably much more manageable to say, we'll just put them in the car and deal with it once we get to our destination, than to insist that, the shoes are on, the clothes are on, everything else. I had a patient once who refused to wear a coat or a jacket, no matter how cold it was. And the parent was, just undone because she knew everyone was judging her when she was, walking out in cold weather with her coat, with her kid out there without any kind of like coat or jacket on. And so she reached a point where she was like, all right, so we negotiated and I got him to wear a blanket. And so he would wear a blanket when he went out. And I'm like, yes, this is brilliant. This is a great way to handle this situation so that like you feel like a good mom because you're keeping him covered and he feels like he's getting that need met because, he couldn't tolerate the coat, but he can totally tolerate, his nice fluffy blanket.
Yeah.
So, just being able to kind of like stand hard and fast by your safety pieces, and then go with the things that are needed for independence.
Yeah.
And then be a little bit flexible with kind of everything else.
Yeah, that makes perfect sense. What's one neurodivergent hack, we're going to call it a hack, that typically works for families, and one that you feel like is totally overrated?
I actually had to think about this because I'm like, oh, I'm not 100% sure. I find that, again, depending on the individual child, because you've really got to think about what's going to work for your kiddo. So I think things like the sensory management, use of visuals, and establishing routines, I think that tends to work for the majority of people. And you don't necessarily have to do all three of those things, right? Like you can just establish one of those things. I think visuals work really, really well. And often I will hear from parents, well, my child is incredibly verbal. They have above average verbal skills. Yeah, but a lot of times in the moment, because of the autism, they can't always access the verbals that they need or want to use within that moment. So visuals can still be incredibly helpful for them. I participate in this autism spectrum in hospital settings, and they do case presentations. And one of the cases presented was a woman with autism who is getting ready to give birth. And so, what does her doctor need to know going into this? And we talked about the use of visuals for like a pain scale. So, making sure even using like the child's pain scale, with the faces.
The smiley faces, yeah.
Using that instead of, where's your pain at on a scale of 1 to 10?
Sure.
Because like in the moment with so much going on, chances are this highly verbal person is not going to be able to access that. Though I think most moms can't really access that during childbirth. But,
I was going to say, even as neurotypical people, it's like, I don't know that I was in the best state of mind.
Right. So, but, I think a lot of times like people think like visuals are not appropriate for their given child, but a lot of times they are incredibly appropriate for anyone. Even neurotypicals, with ADHD, because they have that same kind of difficulty too with accessing the verbals within the moment. So I think all of those things are good. I can't think of any particular hack that I've found to be like overrated.
Yeah. Well, that's fair. I mean, everybody's so different. So what works for one person is probably not going to work for another, or may not work for another. So I think that's fair. Yeah. That's really fair. If you could give one burnt out mom listening a permission slip to stop doing something today, what would it be?
Stop blaming yourself for everything and thinking that you're doing everything wrong. It's like, I find that nobody tells these moms when they're doing a good job, right? Like they only tell them when they're doing a bad job. And a lot of times the bad job is, they're just trying to get through that given moment. So it's not necessarily bad. And we don't know the specifics of the circumstance, so we really aren't in a position to judge. But I find that moms are always the first to blame themselves for any kind of difficulties that their child is experiencing. If their child has a meltdown or a tantrum out in public, it's their fault. They didn't do something right. They didn't follow through on something. And you just can't. You just can't, because otherwise, you would blame yourself for every little thing that happens all the time. And that's not going to be helpful for your own mental health. So just stop with that. Stop feeling like you need to accept blame and responsibility and worry about what other people think of your parenting.
This one spoke to my heart. I think every mom just wants to hear that. Like, you're doing great. You're doing great. You're doing a good job. I think every mom just craves that confirmation or affirmation, because we are our worst critics in so many ways.
Yes. and it's like, you're totally right. I mean, sometimes like a parent will go, well, I know I shouldn't do this, but, and I'm like, sounds like you handled it great. Sounds like you handled it exactly the same way that I would handle it. So you know what? I think you did a really awesome job with that. And, they're kind of taken aback when you do that, because, they just don't hear it. They just don't get that feedback.
Yeah, absolutely. Dr. Kelly, you have been a blast. I've learned so much. This has been so great. I want to wrap us up because you've been more than gracious with your time. We're going to end on some fun things. So The first thing that I like to do with my guest is called Our Turn for a Tantrum. And it really is a tantrum, not a meltdown. As adults, and, a lot of my listeners are moms, we tend to hold it all together for everyone. We rarely get those moments to just like let it all out and vent. So I'd love to hear something that is on your mind that you'd love to vent about. And I'll give you a few seconds for that. And then I'll head into my tantrum for the day as well.
I think so I do a lot of writing. I write psych evals, so of course I do a lot of writing. And one of the things that drives me absolutely crazy is when you cannot get your formatting to work, right? Like it auto formats and you think you changed the auto format and it's still auto formatting and not doing what you want to do. And like sometimes I've had to like chuck whole documents because I could not get the formatting to go correctly. So it drives me absolutely crazy. I don't know how to fix that issue other than, starting over from the very beginning. But yeah, that just, I would be rolling on the ground, screaming, yelling, and kicking my legs for sure.
Oh my gosh. I get it. That's a good tantrum. The worst is when like you formatted it and then it reverts and you can't figure out like why it reverted.
Yes. See, it's, it really gets me, and like, I've had kids that, throw their electronic devices across the room, right? Because they get so mad. That's how I feel. I just want to pick up my computer and throw it across the room when that happens.
I think every adult has felt that way about a computer for one reason or another, whether it's this formatting, whether it's like you can't get the darn camera to work, like whatever the case may be. I think every adult has felt this way. We've just had to hold it all in. And not do that because we know the repercussions and the consequences are too much.
Yeah.
Okay. My tantrum for today is way silly, but it's true. Kids and toothpaste, and especially my kids and their toothpaste. First of all, kids' toothpaste is, and I get why, it's like the most obnoxious colors, right? It's like bright blue with glitter in it, or I have two girls, it's Barbie pink, and I get it. And it makes brushing teeth fun and they're excited. And we obviously want them to brush their teeth and that kind of stuff. But this toothpaste is everywhere, Dr. Kelly. Like it is everywhere. It's on the counters. It's in globs on the tube. It's halfway down the toothbrush. And I know I'm not the only parent that experiences this. And it drives me insane no matter how much I talk to them about like, clean up afterwards. You don't need that much toothpaste. Like it just is what it is. And I know I need to just deal with it, but it drives me bonkers. All right. Final thing, cheat code. So cheat codes are anything that you have implemented in your daily life that has just made your household run more smoothly. Do you have a cheat code today?
Routine.
Yeah.
So like I totally have my morning routine, and thankfully my husband is like out of the house by the time I get up and start my morning routine. But on like days where he happens to be here while I'm doing my morning routine, it is absolute chaos. Like the whole thing just falls apart. So routine works best for me. I know it works best for him as well. But like if our paths cross, like it just does not work at all. Our routines do not jive together.
Yeah. Husband, you heard it here. Get out of the house.
That's right. That is right.
I get it. I, as a habitual person myself, it's like my big blue chair, my coffee, my moments of peace. I get it. Completely relatable. Dr. Kelly O'Loughlin, you have been such a joy. Thank you so much for speaking with me today. I think that this information is valuable for everyone, but I'm super excited for those parents with neurodivergent children who are going to hear this and benefit from all of this information. Any resources that folks should know about or places to go to if they feel that they may have a neurodivergent child on their hands or just want support and resources if they do?
I think the first place to start is always go back to your pediatrician. They should be able to guide you appropriately. And then the other recommendation that I have with like where to get good information is the National Standards Project through the National Autism Center. It talks about like treatments and actually what are considered valid, effective treatments, evidence-based practices that work, compared to things that are just kind of don't work at all. There's also been, a lot of discussion about what's going on with Mr. Kennedy's viewpoints and everything. So I find that that's been a hot topic as well. And so in a lot of like the good kind of places to get information, you'll find good support with that. So the Association of Pediatric Medicine, Autism Speaks has a lot of great information on their website. And in North Carolina, I always recommend the sites ECAC, the Exceptional Children's Assistance Center, and the Autism Society of North Carolina.
Thank you. And you're exactly right. It is so important to have places to go for credible information right now.
Yeah, no kidding.